Good morning. Thanks for joining us. The opioid epidemic is afflicting people all over Minnesota as it is nationwide. 2016, there were 395 total opioid deaths, which was an 18% increase over 2015, the year before. 194 of those overdose deaths involved prescription opioids. 150 overdose deaths involved heroin. And of course, that doesn't count the literally thousands of lives that have been destroyed, and families and communities whose lives and existence have been destroyed with that. So in setting this new initiative, we're picking up on initiatives that began in 2012, but our two-part goal is to save lives and to prevent harm. We're particularly focused on addressing the disparities in tribal communities and communities of color, where the rates of overdose deaths are markedly higher for these communities and than for the state as a whole. But it is addressed everywhere because the problem's everywhere. We're taking additional actions with our existing resources, but we're also asking the legislature for additional resources as the new budget forecast will permit. And I thank the legislators who are here for their leadership. It's been a bipartisan effort and needs to continue that way. Senator Julie Rosen, unfortunately, could not be here this morning, but I thought it was very important that all four caucuses be represented. The action plan, which others can elaborate on, will focus on four key areas: prevention, emergency response, treatment and recovery, and law enforcement. Our initial budget request will be, again, the budget forecast permitting, $12 million in fiscal 19. That money will go for grants to support local prevention efforts, and also a special focus on the 11 tribal nations and the urban American Indian communities. I want to highlight the law enforcement area, $1 million to assist law enforcement agencies throughout the state to purchase naloxone and to train first responders on how to use this life-saving medicine. I'm hoping that the legislature will pass that appropriation very early in the session so that we can get this money out and get that life-saving product out to the law enforcement agencies that don't have it presently. And then starting the next biennium, 2021, the intent would be that the programs be funded with a stewardship fee, which would require the opioid manufacturers to pay a base level of 1 cent on each milligram of active opioid ingredient, which comes out to approximately $1 a pill. This fee would, after implementation, would raise approximately $20 million a year for treatment and recovery, prevention, and emergency response in every part of Minnesota. It was opposed last year by the drug companies, whose products have caused this epidemic and continue to fuel its expansion. And those ongoing efforts should not be paid by Minnesota taxpayers, but rather by the people who created this problem. And I urge the industry to support this measure, and I urge the legislature to enact it. And again, I want to thank the legislators who are here, Representative Baker, Senator Easton and Eaton, and Representative Hillstrom for their leadership in sessions past. And hopefully we'll get even more of their colleagues, both sides of the aisle, to support this effort in the coming legislative session. So with that, Representative Baker.
Thank you, Governor Dayton. Thank you all very much for being here today. And again, I can't thank the governor enough from my heart and from my family's journey on this thing. But from day one, Governor Dayton has been a steadfast champion on this issue because it is so important to so many of us that have been hurt so personally with this issue that we never saw coming. And since my first day here in St. Paul 3 years ago, I've been working on this issue with my colleagues on both sides of the aisle. We all get it, it's important, and there's a lot of different ways of getting it to the finish line. And the one thing that we want to talk about today is how do we And with my bill, House File 1440, which is going to be dropped with a new kind of amendments to it, or a DE amendment, how do we get our next partners to the table to help us? And as Governor Dayton has mentioned, we need our drug manufacturers to step in and say, we are ready to help now with some finances, because we can't do it alone. Minnesota taxpayers have been funding this bill, have been finding every option we can to educate people, but we are running short of the resources needed to really help treatment centers, to help counties with child protection services that are being upside down with their budgets because families are sick with addiction. We need more naloxone in the field for first responders. And we just need more partners at the table to say, you're willing to help now. But this is the time of action. This year is going to be the year of the Opioid Reform Act in Minnesota. As the governor mentioned, 400 people died last year just alone in Minnesota. That's 43,000 people in the country last year died of this opioid epidemic. Now, if I was standing here 10 years ago and would have said those numbers, I would have laughed, because I would have never dreamt we would ever, as a country, would have allowed it to get this bad. It was big news yesterday when I saw Sheriff Stanek sitting next to President Trump talking about opioids. He was a great voice for us yesterday in Washington, D.C. about this issue. So we have a lot of folks working hard on this issue. I am committed to working with my colleagues in the House to make sure that this bill is the right bill to do at this time. And I know my colleagues, all of them, care about this issue very, very much. We're going to work hard to find the right pathway. We think this is the right thing to do today, because we've never seen this kind of an epidemic killing so many people, and we are slow to react on this issue because it came from our medical community that was the most trusted industry we've ever seen. And they were duped, and they were tricked a bit, and now we just have to make sure that we all come together. And I will tell you, the medical community is doing so many great things right now to lower prescriptions. The work group is coming out with some new initiatives, and we are seeing some amazing things happening right now here in Minnesota. And finally, I'm in recovery myself. The recovery is of a loss. And I get to stand here today with my colleague, Senator Chris Eaton, and we are talking to our families that have also lost loved ones, whether it's a child or a spouse or just someone very close to them, because they don't have the voice like Senator Eaton and I do today. But we're here to talk to them about this issue. We're going to support them. We're going to stand up for them. We're going to do everything we can to make Minnesota lead the country on a stewardship bill that is asking drug manufacturers to step in and help us. They never intended bad things to happen, those drug manufacturers. They didn't intend this to happen. But now that they've seen the outcomes, we need their help to fix it. So with that, ladies and gentlemen, I'm going to turn it also over to my colleague, Senator Chris Eaton.
Thank you. I want to start with thanking Governor Dayton, who's always been a good partner on this issue. Like Representative Baker, I lost a child to this epidemic, and so it's very personal. We lost a number of people in Minnesota. I've heard different numbers, but around 400. But the other issue is we've saved a couple thousand. There was a couple thousand people who overdosed, who were saved. And part of that is due to our Steve's Law, which was also supported by our governor, and Representative Baker has been very supportive in finding the funds to find that naloxone to get out into the community. I do want to say that I know that the pharmaceutical companies had the data, they had the studies that showed them that these drugs were dangerously addictive. And they did pursue trying to get doctors to prescribe them more to make money. And whether their intention was to addict the populace or not, that's what happened. And I'm, like many parents who've lost children to this, I'm pretty angry about that. And I don't see any reason why the taxpayers should have to pay to fix this. I believe they owe reparations, as you will. And the stewardship bill will require them to put some money into helping us reverse this epidemic. Yesterday I was at a meeting where Dr. John Kelly spoke from Harvard, and the number one thing that we need to really focus on is recovery. I mean, people need to get access right away. If you're an opioid addict and you decide that you want help, you need it now, because the withdrawals are so awful, you will not stick to it. We need access. It needs to be easy, just as easy to get help as it is to get heroin or prescription pills. Until we get to that, we're not going to stop this. We also need long-term recovery support. Dr. Kelly was showing us that it takes about 8 years for someone to be pretty much in the area where they're likely to recover and never relapse. And so we need long-term community supports, whether that be peer specialists or whatever we use, but that needs to be part of this program also. Law enforcement's important, but we can't arrest our way out of this. What we need law enforcement for is to carry naloxone and to get the drugs off the street. I'm so grateful for all the support I've received, and for Senator Julie Rosen for carrying the bill in the Senate. And I'm willing to work with anyone who's willing to help us get this through. Thank you.
So I'm State Representative Deborah Hillstrom, and I want to thank Governor Dayton and Senator Eaton and Representative Baker for their leadership on this issue and for supporting a comprehensive approach to the opioid epidemic. Here in Minnesota and across the nation, we continue to experience unnecessary, heartbreaking, and destructive losses for our families. And these are not simple solutions, but we have to solve this horrible problem that we have. The opioid epidemic has highlighted that no region of our state, no demographic, or no socioeconomic group is immune. This means working together to enact strategies that will work. It also means providing the necessary resources to ensure that these strategies can be effective in our communities. And today's proposal does just that. We see resources directed towards law enforcement, healthcare professionals, and local communities. We work both on prevention and treatment through funding early intervention programs like SBIRT and other innovative tools, and the naloxone is so important. I especially want to thank Governor Dayton for his commitment to the Native people in this proposal. It's critical that our tribal communities be given the tools to help protect their folks from these dangers as well. Senator Eaton and Representative Dave Baker and families from across Minnesota have experienced unthinkable tragedies. And we have a responsibility to Minnesotans to keep Minnesotans safe. And the governor's proposal will save lives. We are all committed to getting this done this session. And next, I want to introduce Commissioner Malcolm to provide the next remarks.
Thank you, Representative Hillstrom. Good morning. I just would like to make a couple of comments about the comprehensive nature of this proposal, the fact that the opioid crisis is clearly one of the major public health issues across the nation, and our state is no different. You've heard the data. 400 Minnesotans almost died in 2016 as a direct result of opioid overuse and overdose. That is a rapid rate of increase over prior years, and we're seeing that continue. And as Representative Hillstrom just mentioned, it is truly a statewide problem affecting every single community and demographic group. It also affects, to a great degree, stark and growing disparities, populations in our Native communities and other populations of color. So the community-based prevention grants that are part of this package are appropriately available to all and targeted where the need is the greatest. I just would like to emphasize that this package builds on several years of comprehensive integrated work across our agencies at the state government level and with our local partners in local government, but in the community as well. You've heard examples of what's happening with healthcare providers becoming more attuned to this issue and stepping up to work hard with us on changing prescribing patterns. And you've heard about the critical role that first responders and law enforcement play in providing on-the-spot treatment, as well as helping to get people into the ongoing supports that they need. And we in public health, of course, always look for the prevention opportunities. Some of these prevention funds will allow us to better understand the causes and the points of intervention earlier upstream to prevent more people in the future from being harmed by this epidemic. Just to emphasize the point of the local relationships and the importance of an integrated approach, the governor mentioned that a piece of this proposal is to increase funding and increase supplies of naloxone, which we would love to see happen as soon as possible in the session. We have got the relationships in place already with local first responders that would allow us to get that money out into the community almost immediately. And I think that's a feature of this entire proposal. Building on the work that we've been doing, these are resources that we're going to be able to put to work for the benefit of Minnesotans in very rapid fashion with evidence-based solutions to make a measurable difference in this epidemic right now. Thank you very much, and I'll turn it to Acting Commissioner Johnson from DHS.
Thanks, Commissioner Malcolm. I'd like to speak a little bit about how this package came together. As Governor Dayton referenced, we started in 2012 working across agencies at the cabinet level to address the issue of substance abuse through a group called the Substance Abuse State Strategy Group. And that group really focused a lot on the issues that touch all the different systems, the healthcare system, the school system, what we do in child protection at DHS, all being impacted by substance abuse. In 2014, we refocused that work really to focus on opioids and created a group called the State Opioid Oversight Project. And that group has worked for the last 4 years on really advancing initiatives to help tribes, to address opioid prescribing, to address the neonatal issues that result when children are born addicted, and putting those issues at the forefront of the work we've done across agencies, as well as the work that's been done by the legislature. Group was also really instrumental in the implementation of the funds we received from the federal government last year, state targeted response grants and grants for medical assisted therapy at really trying to target that. When Governor Dayton said that he wanted to bring forward a package this year, we spent the summer and fall working across agencies to identify where are the gaps that we need to address, the gaps in prevention, in treatment and recovery, in law enforcement, and in emergency response in order to make sure that we're addressing the issues that are most needed for Minnesota to address this crisis. And that's the package that we're bringing forward today. So with that, I think that we would take any questions on this topic.
Let me just say that Commissioner Piper from All Reports and Lucille are doing very, very well. We're fortunate to have her Chief Deputy, Commissioner Johnson, be stepping in to take her place so admirably in the next 3 months. Her timing in having her child 1 week before the start of the legislative session and then getting a 3-month maternity leave is just another example of her sense of impeccable timing. And we have some advocates here who are here as the front row as guests. I wonder if any of you would like to add anything to your perspective on this? Yeah, why don't you come up here?
I wasn't quite prepared to make a public statement. I was just going to, Sure. Lexi Reed Holtom, Executive Director of the Steve Rumler Hope Network. And I just wanted to say thank you to all of the legislators here and the governor for their tireless work. What I know to be true is that I lost someone to the opioid epidemic, and he was prescribed pills, and those pills led him down a trajectory that caused him to lose his life. And that was in 2011. And in 2011, we started the Steve Rumler Hope Network. There were 15,000 opioid overdose deaths a year in our country. And now we are at 42,000. And this is just simply unacceptable. I have my daughter with me in the front row, and she herself is working on creating solutions. What are we doing for our youth? The trajectory of our country is terribly frightening, and if you don't believe that to be true, you should just take a look at the demographics. The population that was most impacted up until recently, up until this year, was middle-aged males. And I would ask you to think about what is happening to our country if the demographic of people that are dying the most are between the ages of 40 and 50, or 44 and 55. That age group is the age group where you're supposed to be generating revenue, contributing to society, paying taxes, taking care of our elders, taking care of the youth. And if they are dying at incredibly rapid numbers, who is leading our country? And this, I agree with Senator Eaton, is not a mistake. The pharmaceutical industry did know what they were doing. They have lost lawsuits that state that they knew that these drugs were addictive. And so I would ask you, please, let's create the solutions so we can take the burden off of our taxpayer dollars. We need to implement them right now. 42,000. 6 years ago, it was 15,000. Thank you so much for your good work. Thank you for the opportunity to speak. And thank you for the young people who are making sure that they find solutions too. Thank you, Governor.
Thank you very much. Thank you. You're much more eloquent speaking extemporaneously than I am prepared. But thank you, and thank you for your leadership too, and those who work with you. We'll open it up for questions on this subject and then throw it open thereafter.
Governor, I'm curious about your funding mechanism for this. You've asked for an appropriation from this year's legislature. Is the intention for that to be one-time funding and then that program being backfilled by the penny a pill provision that you hope the legislature passes?
Well picked up, yes. We're told by M&B that it's going to take a year if this penny a pill passes to get it set up within the state system. So it could take full effect in the next biennium, which would then generate an estimated $20 million a year. So for this 1 year, fiscal 19 upcoming, we'll need general fund resources to pay for what we want to do. If not, it'll just have to wait for, assuming that the penny a pill passes, we'd have to wait for another year to get geared up.
Governor, is there any fear this is deemed a tax? You call it a stewardship program. We remember Governor Pawlenty and the health impact fee that was later deemed a tax. Could this be considered a tax?
You can call it whatever you want. It means that they're going to pay for the product they're producing that's causing this epidemic. It's. I hope they do see it as a stewardship. I hope they do see it, as has been said so well here today, as a shared responsibility, and they need to be in the forefront of that.
Representative Baker, are your leaders in favor of this?
Thanks for that question. And I think I will tell you what my leaders are in favor of is doing something major on this issue. I've been having some very good conversations with our speaker. Our leadership team knows exactly what my bill is and what it isn't, and they have said to me, you keep working hard on this issue, because this is something that we are going to do something this year. I feel strongly that our speaker supports something strong. Again, the question when it comes up, is this a fee or is it a tax? Let's call it whatever you want to call it. And I don't typically like a stewardship fee or a tax. I mean, I'm a Republican, for crying out loud, and I don't like the sound of that. But what I will tell you is, for this issue today, this is the best option for us to help fix this problem. Because I haven't seen anything when we've done a stewardship fee before in Minnesota on car batteries, electronics, rubber tires. But this is, people are dying. And this is the time that we call whatever we want to call it. But I think we need to ask the folks out there that can help us with a fee or a tax. But this is very specific about how it will get spent to help communities in recovery. So I think our caucus is going to do something strong this year on opioids. This is my best option. I've been working on this bill for a couple of years as well with my colleagues, and we're going to fight hard to make sure this is a good option that we can look at as Republicans and lead on this thing.
On penny the bill.
I don't know what that is at the end. What I've learned in the short time that I'm here, this is my best option that I'm going to tell my colleagues this is what I believe in strongly. I just know that I'm one of 134. So I will tell you that I want this to pass. I'm working really hard to make sure this bill passes. Can we do it? I don't know what it's like at the end of the day. I don't know yet, but I'm going to work really hard to educate my colleagues to tell them, if not this, then what? because this is, in my opinion, the best option to bring new partners to the table that have not been here yet.
Representative, Senator Eaton used the term reparations, meaning some degree of intent, I think. I'm probably not misrepresenting your thoughts on it. What do you think about that?
Well, again, we've been in the midst of this epidemic for a long time, and the damage is really, I think the number came out, $500 billion in the cost of our economy nationally, $500 billion a year. And yes, there's been lawsuits, there's more coming. To me, I'm not a lawsuit fan because the wrong people are getting the money. I think we can, in the state of Minnesota, lead a reasonable common sense approach to legislation and the legislative fixes that will provide us some new ongoing money that will help us repair our communities with community grants and other things like that to just help us move forward. We can't get our loved ones back. We know that. But what we can do is looking ahead, getting the people. I remember in 1982, Johnson & Johnson did the right thing by pulling Tylenol off the shelf when they didn't know what was going on. And they pulled it off the shelf for quite a while. That gave me a huge amount of trust for a company that probably didn't have to do all of it off the shelf around the country, but they were afraid of not knowing what was going on. Imagine if that would have happened this year, or a number of years ago. What would have happened? I think we would have seen different outcomes, and I want the folks that can actually do the right thing this year to step up and do the right thing.
Follow up with the representative on that. And you're familiar with negotiations and trade-offs as a lawmaker. Let's talk about the lawsuit. If in fact the pharmaceutical companies agree to the penny a pill or something kind of like that, a stewardship fee or whatever you want to call it, would you encourage the plaintiffs, specifically the county attorneys in that lawsuit, to drop their action?
Boy, I don't know if I have any ability to comment on anything like that. I am laser focused on this bill.
You have certainly some weight as a state lawmaker in this area.
If they ask me, I'll tell them my opinion, and I think if we get it to that point, I will do that. What's interesting about our versions of the bills that we're moving through each body here is the governor has a stewardship fee that is similar to mine. Mine is a little different when it comes to not a morphine equivalent, but it's based on a modifier that isn't quite as high per pill. But at the end of the day, we're trying to find solutions on how to get them to participate. I think Senator Rosen has a little different version than I am. Our hope is we get to the end of the day, towards the middle of the session, so we don't wait till the end, but we actually find the best way that we can all agree on how do we move forward on a reasonable common sense bill that isn't going to increase the cost of health care to a point that I'm afraid lawsuits may do.
Providers have also been criticized.
Did you want to respond to that?
I do consider it reparations. Many of the parents that I've talked to are angry. They believe that knowing that these medications were addictive, that the pharmaceutical companies did not step up to their responsibility to protect the public. And so, yeah, I'm fine with calling it that. I know that a lot of my Republican colleagues are not quite as comfortable with that. But I do want to tell you that for every dollar we spend to work on this issue, we save 12. This is costing our economy a huge amount of dollars. We had economists yesterday at a forum I was at that from the Federal Reserve talking about the impact this is having on our GDP. So this is important in every aspect you want to look at it, whether it be economic, whether it be lives, and the right thing to do. This is important.
Representative Hilson, you want to represent either the legislature or the county attorneys?
Well, I can't speak on behalf of the county attorneys, but we all have a role to play in this, and if the pharmaceutical companies haven't been playing their role in taking care of the problems that they created, now is the time for them to step up and either be a partner or not. So far, I haven't seen anyone step up to be a partner to solve this problem yet. That doesn't mean that they won't. There is a lot more to do than just this proposal as well. And so if there's going to be a broader discussion about should lawsuits stop or should things happen, you're talking about a much larger price tag than what's being proposed here. So some folks should be careful what they wish for.
I'd just like to add, our proposal here is our starting point, but I'm very much looking forward to working with legislators here and others and taking their ideas. They've been involved in this in leadership positions and as legislation that precedes this proposal. So we're wide open to work together and come out with the best ideas, the best outcome.
Commissioner Malcolm, can I ask you a question about naloxone? Are you the proper one to ask that?
Well, I'm not an expert on it.
Whoever said yes. What is the shortage that we have? What is the problem we have with that right now? And do you have a way to quantify how many kits we're going to buy, where they're going to go? Do you have that?
I do not have that data at hand here. The point I was making was just our ability to get that resource out into the communities immediately by virtue of the relationships we already have. If there's anyone else who can speak to the naloxone current supply, that would be great.
Sure, is that not enough people have this?
Right. Does anyone here have that?
I can answer that. So with the state targeted response, our state has issued grants to 4 agencies to provide naloxone. One is going through MDH, our first responders. One is going through the Steve Rumler Hope Network. One is going through Valhalla, and one is going through RAN in Duluth. And we all have the ability to distribute 3 different kinds of naloxone. Most of us distribute the least expensive kind, which is the IM, but all of our first responders use nasal, which costs $37.50 per unit. Most of our first responders need to have 3 units on them to be able to reverse an opioid overdose at this time. We know for a fact that they do not have enough money to provide, I think it's 54, how many first responders do we have in the state of Minnesota?
Anybody know that?
But the point is that not all emergency responders have it, and the ones who have the kits don't have enough.
Correct.
Is that fair?
Correct. For example, in Duluth, the first responders, law enforcement in Duluth, are asking us to provide them with their naloxone because they don't have enough. So we're providing Duluth, and what they need is $36,000 worth of product for 1 year in that county. So that's just one county.
I think we could probably pretty quickly pull that data together for you.
Well, but I'm just doing the math quickly here. So if you need 3 doses to be effective response, that's over $100 for every response. And that's why we need to provide assistance to law enforcement whose budget's starting to set up to accommodate this additional cost.
It looks like the pharmaceutical corporations are the ones that are being held to task on this, but not the providers. They're not being asked to kick in on the penny a pill kind of thing. Why is that? Is it because you want to concentrate on education efforts, or is there some other reason that they're not part of this?
Well, I don't rule anybody out. This is, again, as I said, is a starting point, and you'll see what evolves with the best minds of the legislature and the groups that are stakeholders in this process. So I don't mean to exclude anybody. I don't know there's quite a number of initiatives that providers have taken, some of which the legislature is required, some of which they've done on their own. So they have been involved in starting to address this problem, and anybody wants to elaborate on that? Yeah.
I am on the opioid prescribing work group, and we're working on recommendations for prescribing, and we're also working on a process to hold doctors accountable and to make sure that they're not over-prescribing. We will be reconvening exactly next Thursday, and we will start the process of determining what kind of feedback we're going to give doctors and what kind of process we're going to use if there is going to be any discipline. Essentially, we're talking about doctors who prescribe under Medicaid. Those are the ones that the state has control over who they prescribe to. So they would lose the right to prescribe under Medicaid if they refused to change their prescribing behavior.
Senator, along the same line.
Last on the topic.
On the prevention aspect, and maybe the commissioner can address this, or I'm not sure who the right person is, but you're trying to track folks who are using these opioids beyond what they should, I would assume, and that's a medical record situation. I think a lot of us know that there's poor coordination of medical records in a lot of areas, poor information sharing. Is that part of this proposal, and can you talk a little bit more about that?
We're working on updating the prescription monitoring program to make it more easily accessible to the doctors, so that instead of having to log out and re-log in to get the access to what prescriptions that patient has had, especially opioids, they would it would show up on the same screen as the rest of the data that they get on the patient. So that's going to take some money, and I know that Representative Baker has talked about emphasizing that in our bill to provide some of those funds to the state of Minnesota facilities to upgrade their systems.
How do you track doctor shoppers? You know, the guys people who go around and, well, this doctor won't prescribe it, so I'll go to another doctor. How do you get that information?
Well, PMP, the prescription monitoring program would show that if people check it. Right now, it's mandatory to be registered for a doctor. It's not mandatory to check it, and that's part of what we're hoping that our opioid prescribing work group guidelines will facilitate monitoring, especially because most opioids are prescribed under the Medicaid program.
I have another question on this. Like a final word? I do have another question that you haven't touched on, if somebody could answer.
Last question.
One of the least known problems probably is the babies born to mothers who've been on opioids. What does this package today do for that situation? Does that help any?
Well, we got to wait for sure.
Thanks. That is a key issue. We had over 1,300 babies who came into our child protection system in 2016 who were addicted at the time that they were born, and so we're really seeing the impact in that part of our system. The state targeted response grants that we released last year had a number that were directed at really trying to address the neonatal issue, connecting with moms who may have an addiction problem, trying to get them into treatment, trying to get the health care wrapped around so that when the baby is born, we can have the best outcome possible given that situation. We also have some grants in the package that the governor is introducing today that would also go to that purpose to try to address those issues that are really one of the most concerning when you have a baby that's born, and trying to find and catch those moms early before it becomes a crisis.
You're welcome. Don't have to, you can stay around and watch all the fun that follows. Okay, Don, the program has asked all the questions, so I expect this will be extremely brief.
Governor, yesterday I asked a question about the idea of continuing appropriations, and you didn't respond to it. So you and somebody in your position might have the most to lose, because that could effectively eliminate your line item veto. I wonder if you can see your way toward supporting a bill if it were modified in some way. Is there any way you can see a continuing resolutions bill being palatable to you?
Well, I do take the Supreme Court very seriously, and they intended it as such, and in the oral arguments, the Chief Justice really pressed the point, what authority does the judicial branch have to step in and designate the continuing appropriation of money if the legislative authorization is expired? So, I think it needs to be very, very careful thought. Whether it can come together in this session or not, we need to get different views. I've heard people say that, well, if you don't have an appropriation bills and funding continues at 90% for those who want to reduce state budgets, that's an attractive way to do so. The federal government operates on continuing resolutions ad nauseum, and we want to avoid that. My experience has been that unless you have a final deadline with serious consequences, you're not going to get people to compromise, especially on billions of dollars, things they believe in or don't believe in. So having a serious consequence at the end of, used to be the end of the session, now it's, June 30th, is I think crucial to getting a resolution, which is what you want. What do you do in the interim when that doesn't happen? I guess I don't have a final thought on it. We should look at the possibilities, but consider carefully the unintended consequences of whatever is done.
Do you see any version of that actually working for you?
Well, I hope it's not going to have to work for me. For my successor, I think I don't have an answer for you today. I don't know what the trade-offs are, what the other proposals are. I think everything deserves, serious consideration, and you have to compare one from the other, and to see whether the, executive, an anathema to the legislature, but to see what the powers the executive has or should have to carry on. And you obviously don't want to close the prisons and things like that if they're go past June 30th. So all these things need to be factored in.
Other questions?
All right, thanks, everyone.
Okay, thank you.
Michelle, what was your
We just had him yesterday.
You want to stand for one out of blue? Absolutely. Can you get the
Another
leaders?
selfie.
Can you get the leaders to attend?
No. We'll show you that downstairs.